We are a multinational organization. We have hospitals in the United States, Mexico, Chile, and Colombia.
We are in a race to become a highly innovative healthcare system with declining reimbursements and funding. The bottom line is kind of drying up.
When we sit down at our corporate budget conversations once a year, we're a magnet for every bow and arrow shot in the organization. What we've been able to do with TBM is to actually diffuse a lot of that conversation even before we get into the meeting.
Because we're shared a service center, we need to always look at and make sure we justify all the expenses we have.
Very often, the place that you find cost savings is around labor reduction. So we got together as a leadership group, and Aaron said, let's see if we can run some information out of Aptio. Lo and behold, we found that there was over $50 million of spend that had come through from our corporate departments. We started bringing those conversations of cost transparency into our associate level all hands meetings.
So what we're beginning to be able to do with TBM is to begin to model what are the impacts of being expeditious.
Can we steer this particular client to a more cost-optimizing solution?
If we have two systems that do exactly the same thing, what do those cost us?
We have a $150 million budget this year, and any kind of increase that goes on over year, CFOs really want to battle it out.
In past years, we had arbitrary reductions being proposed to us. And it was a purely defensive conversation at that point. And everybody would look at me with glassy eyes and say, no, we want to keep all the services that we're doing, and we want you to cut your budget by $10 million.
Now that we have one tool, we can put all our budget in for every department and every cost center. All the managers can log into them and get their data and information.
This time we had one budget meeting. We came in, we presented our information. Everybody looked at it and said, okay. That's what it costs to deliver the IT services for the organization.
Because we have that clarity with our services, we tie this back to our business initiatives of population health, asset growth, clinical and operational excellence.
The conversation now is a much more realistic one where there's good sharing between us in information management and the rest of the leadership group around the organization. TBM gives us the capability in a real-time kind of way to be able to manage our organization much more effectively and efficiently than we have in the past.
I think it's powerful when a customer, along with being able to look at what they want to do, can reach some conclusions on their own about what the impact of that cost is going to make long-term to the organization.